How do you deal with unprofessional doctors with a God mentality? It depends on what position you are in when dealing with them. As a PA, I have dealt with my fair share of difficult people and physicians. I grew up in an area where physicians and PAs had significant respect for each other, so while I had the occasional grumpy specialist, I never felt threatened or disrespected. Fast forward 10 years and I worked for the federal government and moonlighted at a local ER. When I started, I was warned about one surgeon, Dr. Mean, who refused to speak to the PAs, so most of my colleagues simply had the attending ER physician call him whenever they had a patient that needed surgical intervention. After I had been there a while, and had just returned from a deployment in a conflict area, I was working a shift in the ER when I had a patient with appendicitis that needed surgery. As luck would have it, Dr. Mean was on call. You can imagine the frame of mind that I was in, being that I had just returned from a place where I had a close collegial relationship with some of the best surgeons on the planet. After updating the overly busy ER attending of my patient and plan, I requested that the unit secretary call Dr. Mean and connect him to me. After he got on the phone, I politely introduced myself and began to give him the rundown of the rather straightforward case. I heard, "Stop. Stop. I will only talk to the attending. Get him on the phone." I responded, "She is tied up with a patient," and added, "You have a patient in the ER that you need to come in and see, as you are on call." I then hung up. You see, the on-call surgeon is required to see all patients that need their treatment. The ER providers are not required to play games with getting help from specialists. When the surgeon arrived, he stormed over to the physician demanding why she had not called him personally about the case. To his surprise, the very capable, former Army colonel gave him a piece of her mind in an attempt to bring him up to speed on how medicine is now practiced. Oh, and she wrote him up to the medical staff board, but that was only after she told him that in her ER, he would behave appropriately, respect all staff, and get the report from and the PA.